Each year, between 5 and 20% of the population get the flu. It's a respiratory illness that infects the nose, throat, and lungs. Does it sound familiar? That's because its symptoms are nearly identical to coronavirus, with the only known difference in symptoms being the loss of taste and smell. And with COVID still around, parents are worried about tackling both this fall and winter. Ursula Perry with how you can attempt to tackle both this fall.
The coronavirus is a new battle that we add to the flu season. And while social distancing is in effect, there are still carriers that can stir the confusion: school children.
That's all you need to get influenza around your community is kids in school.
So, how can you protect your kids? Doctors say it's important now more than ever to get a flu vaccine.
It's not only to protect ourselves, it's to protect the people around us that we care about.
And it's even more important if you've already had coronavirus.
There's a good chance you may have some lung injury, and we don't want to add influenza lung injury on top of that.
The flu vaccine does not prevent COVID, so there's still the need for children to be socially distant.
Is cohorting, keeping children in small groups so that if one child in the group gets infected, it doesn't infect the whole classroom.
And be sure to establish a daily routine with your kids. Give them a spare mask and hand sanitizer for the day. Instruct them to only touch the non-cloth parts of their masks. And remind them to wash their hands throughout the day, as well as when they return home. Keep their shoes by the door. And if they wear uniforms to school, wash them after just one wear. Here in Bexar County, some med clinics say they're already seeing their first cases of the flu, meaning if you haven't gotten your flu shot yet, it's time. Children can begin getting their flu shots at 6 months old. Ursula Perry, KSAT 12 News.